Wammo breakfast. Only on Kiwi.
Yes, well, today is Speech Language Therapy Awareness Day. Who knew? Well, we do now, and we're going to be chatting to Nicki, who's a speech language therapist at Christchurch Hospital, to tell us all about the issues surrounding speech language therapy and why there's an awareness day today. Hello to you, Nicki.
Good morning, Wammo. How are you?
Very well. Now, I think this day has taken me by surprise. It's probably taken most people by surprise. It's the fact that there is an awareness day for speech language therapy. Why is there a day?
Well, I guess it's about raising the profile of speech language therapists. It's a profession that people tend not to think much about until, you need one. And it's also, I guess, some people have a misconception about what speech language therapists do. They see us as allocutionists or teachers or a role along those lines, where we actually work in a wide variety of areas. We work in health and education and work across a wide variety of areas in terms of remediating communication and swallowing and feeding problems or disorders or issues or whatever you'd like to call them.
So it's even covers a little bit more than actual speech itself.
Absolutely. Our role has certainly evolved, but our name hasn't evolved with us.
Right.
So I think that's as much about raising the profile of that as well.
So is this you guys collectively putting up your hand and saying, hey, we're over here?
Absolutely. That's exactly what it's about.
Now, you said just before that we don't sort of think about you fellas until we need you. When do we need you?
Well, there are a variety of times that I guess we're called upon. In terms of the education setting, I guess that's a lot more children who have developmental delay or issues that are related to things like having something like Down syndrome or autism or something along those lines. In terms of the role at Christchurch Hospital, we have a lot of people who work with people who've had strokes or brain injury or who have degenerative neurological disease, working with them with speech around communication and swallowing issues. I myself work in paediatric feeding, so that's from newborn babies basically right up until sort of 16. Babies who are born with cleft lip and palate, obviously that can lead to issues with feeding and speech later on. And we have therapists who work with head and neck cancer and voice and a variety of, as I say, there's a massive continuum and it's a very big area, really.
Would you say that you guys post some kind of event, whether or not that be an illness or well, I suppose mainly an illness I'm thinking about, you guys kind of pick up the pieces afterwards a little bit?
I would certainly say we're one of the team members that's there to sort of support both, I guess, the person and their family through what's going on and helping them try and make sense of it.
Yeah. Do you cover right from the very mild, I guess, end of the spectrum, being the simple things like lisps?
Certainly, there are speech therapists out there who would be targeting lisps. Absolutely, right up to people who are unable to talk at all now, and so are requiring communication devices.
And what kind of methods do you use to get people talking again?
Oh goodness, that's a tricky one for me. I very much work more in the pediatric setting, but in terms of getting people talking again, there are various programs that can be worked through, and there are alternative devices that can be used. There are, I guess, ways of communication boards and devices that can be used to support people who are unable to talk and may not be able to talk in the future. Right,
so it's not necessarily all about actually getting speech back. It's just trying to find ways to communicate.
Well, sometimes it very much is. Obviously, ideally, we want people to get back to being able to talk if that's possible, and to be able to communicate. But it is all about communicating and swallowing.
Well, swallowing is pretty important for
human beings, isn't it? Swallowing is very important.
Yeah.
And I guess that's the part of our profession that people tend to forget about because it's not in our name.
Is swallowing a big problem, for many people in New Zealand?
I would say that in terms of people who've had strokes, that would be in particular, but in terms of the adult patients who are seen at Christchurch Hospital, that would be what we're mostly seeing patients for. We have obviously an acute caseload at Christchurch Hospital, so patients who are seen just after they've had their injury or their stroke, or when they've just sort of post-surgery had from cancer, and that's what we're that would probably be the first thing that we're sort of looking at, the swallowing side of things.
What sort of training do you go through as a speech language therapist to get where to be a fully fledged therapist and working out there in the community?
Well, there are now 3 programs, speech language therapy programs across New Zealand. I myself did the program at Canterbury University, which is a 4-year program, a sort of an intermediate year, and then a 3 years of professional training, which requires obviously contact with patients. So it's very much, if you think in the realms of a medical degree, where you have to do a theoretical side of things and a practical side of things, and then a lot of on-the-job training. So
it's quite intensive.
It is very intensive.
Do a lot of speech language therapists kind of evolve out of learning sign language?
Ooh, you mean they start off learning sign language and then they? I don't know. That would be a question for to ask.
That wasn't your journey. I mean, how did you get into it?
That's a really good question. Basically, I was very interested in languages, and I was really interested in science, and I kind of tried to see what would mesh those two things together. And I found the speech language therapy degree and started it, and just loved it and ran with it since. And then I did a placement at Starship Hospital in Auckland and loved paediatric feeding and swallowing, and now I'm at Christchurch Hospital working with basically newborn babies who have feeding issues, slightly older children who have feeding issues, with the cleft lip and palate, children who have cleft lip and palate, working with them around feeding and speech issues that they have.
So you obviously find it a very rewarding career path.
Absolutely. Dream job.
Yeah,
Dream
really?
job.
Wow. Because most people would turn and run, wouldn't they?
I don't know about that.
I mean, it can't be easy.
I wouldn't say that it's an easy job, and I think that again that's part of the misconception with the allocutionist teacher sort of side of thing, or not kind of people being aware of our role in other areas. I do think people have a simplistic view of what speech therapists, or some people, that was a very generalistic statement, some people have a simplistic view of what speech therapy is, but it is very varied and very interesting, and certainly at Christchurch Hospital, no 2 days are ever the same.
Yeah, so as a group of professionals, are you facing any issues inside the health sector at the moment?
I guess one of the big issues that we're trying to follow at the moment, to chase up at the moment, is getting ourselves accredited so that we become a registered body of speech therapists at the moment, in the same way that doctors and nurses and other health professionals are. I guess so that we have accountability in terms of our jobs, and that we are a registered body that we can go back to. At the moment, we have a great professional body, the New Zealand Speech Language Therapy Association, and that's fantastic, but we kind of need a bigger, more formal proceeding on top of that.
And how are you guys marking the day today, apart from media interviews and that kind of thing?
This week we've actually tried to get a really high profile around Christchurch Public Hospital. We're having a Where's Speechy competition today.
Is it a mascot?
Well, not so much a mascot. We're all dressing up a bit in the vein of Where's Wally.
Right.
And if you spot a speech therapist today at Christchurch Hospital, you'll be rewarded with a sweet treat.
Right.
and
you guys will be quite obvious.
Yeah,
I
think we pretty much will. And our department, you've never seen so much red and white Where's Wally pictures and everything more than you could imagine.
Fantastic. Well, it's certainly great to talk to you today and find out about speech language therapy. And I think I've learnt a whole lot, and hopefully everyone else has as well.
Right.
And it's good to know that you're out there, and if I need you, I'll give you a call.
Lovely. Thank you so much for having me.
Nicki Mason, thanks very much.
Awesome.
Nicki Mason is a speech language therapist at Christchurch Hospital today, celebrating Speech Language Therapy Awareness Day here on Kiwi.